Hi, Shiloh.
Hi, how are you doing?
I'm doing great. How about you?
I'm good. I'm good. So, just to tell you a little bit about the company that I'm with, I work for EverydayFamily.com. We are a pregnancy and parenting website. We've got over 4 million members, so we're a blip on the radar now. Anyway, I'm also a mother. So, I've got a 5-year-old daughter and a 1-year-old son. So, I've been
Ooh, you're
through
busy.
pregnancy a couple times myself.
Yeah.
Yes, busy. That's right. And, I wanted to talk to you today about MVP and how much it affects moms. And I know with Mother's Day coming up, this is anything we can do to help our fellow moms, right?
Oh, you're absolutely right. That's what it's all about, helping the fellow moms.
Exactly. So MVP, let's talk about it. What does that stand for?
Essentially, nausea and vomiting in pregnancy, which means morning sickness. And it's a better name,
Exactly.
as you may know, than morning sickness because morning sickness can happen all day long. And it
All
doesn't
day
have to
long.
be in the morning. And it can be really severe. There's a range. Some women will just have a little queasiness. Others will, just feel like they're about to throw up every minute. And some
Hmm.
will actually be running to the bathroom and throwing up. So the
Yeah.
idea is that women don't realize, even though it's so common, 85% of pregnancies are affected by nausea and vomiting in pregnancy. Yeah, that translates into 3.4 million women a year, pregnant women a year. So we need, even though it's common, it's a medical condition, and you can treat it either with dietary and lifestyle changes or other options that I'd love to tell you about.
Yeah, let's talk about that because I know, like, even just between my two pregnancies, things have changed, and they're always changing and evolving. In my first pregnancy, I had morning sickness pretty severely, not to the point that it can be with people, but they had put me on Zofran, which now there's all these studies that are kind of naysaying that. And then with my second pregnancy, I was put on Diclegis. So I'd love for you to kind of talk about some of these different treatments and the thoughts behind them and what are available, as well as, non medication kind of treatments too.
Yeah, let's start with that because that's what really truly we want to start with is the conservative
Yes.
management. So dietary, lifestyle changes. A lot of women will, avoid spicy and greasy
Hmm.
foods, which are hard to digest, and so that'll just add to it. Eating
Yep.
the one of the other mistakes a lot of women will just not eat, and that builds up the stomach acid. You want to eat smaller meals more frequently,
Yes.
and
Yes.
not
I would
eat.
keep saltines by my bed in the morning and eat them before I even got out of bed.
That's the picture, and I come back to it again and again as I had crackers like I'd pull them out of my purse, pull them out of my car,
Yep.
everywhere. They were just everywhere, and
And
so
even though
things
it
like
tastes gross and you don't want to be eating them, it's
you
not
don't.
it's not appealing, but you have to.
Because it's the only thing that if that's the only thing that helps you, it is. And that's exactly why
Hmm.
we're talking today, because if those things don't work, then the idea is don't wait. You need to talk to your physician because exactly why I'm so thrilled to have partnered with Duchenne USA, is to talk about Diclegis, because it is the only FDA,
Only. Hmm.
yes, approved, safe and effective prescription
There's
treatment.
actually been testing done on it with pregnant women,
Yes,
right? It's the
you
only drug that they've done that with that has been. I mean, it's awesome. It's wonderful.
Yes, you are absolutely right. And that's why I'm so excited about it. So that women can feel, a lot of women are so worried about prescriptions. Women can feel, at
Hmm.
least with this, that they don't have to be miserable and they're safe and they're not going to be harming their baby. To empower women. That's what we're all about. I mean, pregnancy should be the time where you feel like the most powerful human being on the planet because you're giving birth. So,
Exactly. And so
yeah.
many people think, "Oh, I just have to suffer through this. I'm
No.
a mom now and this is just part of." And it's like, "No, you don't. Like,
Yeah.
you don't have to be miserable."
No, you don't. You don't have to be miserable, and you're not sacrificing anything of your baby for actually being happy. And so that's
Exactly.
why it's really important to get this information out to women so that they know. And again, to get away from the stigma of you just have to like suffer through it, bear through it. Don't suffer in silence. Get the information and empower yourself so that you can really feel good during your pregnancy.
Now, so with the Egg I know when I was going through it. Now, granted, this was 2 years ago now because my son's one. It was newer or had been back on the market fairly recently, and a lot of insurances weren't covering it. And so they had coupons on their website
Hmm.
that, like, I ended up getting a reduced rate. I think it was only like $30 a month or something, and it was fantastic. Even though my insurance wanted to charge like $300. So do you know, are they still having anything like that right now,
Well, the website
or
is
is it more widely covered these days by insurance? Has it gotten to that point?
Yes, it is much more widely covered by insurance, and the website is great. It's diclegus.com, and there'll also be my Dr. Lisa tips in pregnancy, as well as other
Okay.
information and education about nausea and vomiting in pregnancy. So it's a wealth of information
Good.
and different things for pregnancies. So it's definitely something you want to visit. You're absolutely right.
Wonderful, wonderful, great. So I mean, I'm really excited too that there's a solution, for people, and and to go back to other natural remedies. I know some people do ginger, and they have like the little bands for your hands, like the C bands, those kind of pressure point acupuncture. Those were some other things we tried, but for me, the diclujus, it worked wonders, and I recommend it to people. So I'm glad to get this information out to our members.
Oh, that's great. And you're actually, even a lot of physicians don't have that information. So that's, again, why
Yeah.
we're speaking about it today, so that everybody knows what's in the arsenal that's safe and effective to help, to help the
Exactly.
mommies. Yeah.
I asked my doctor about it because they didn't suggest, they actually suggested Zofran. And I'm like, well, I've kind of heard that that's not the best thing. And now there's this new thing. So and they knew about it, but they were not promoting it yet. So I'm glad
Right.
that it's starting to, take foot and we can get the word out. So
Make some happy mommies.
thank you so much.
Thank
Yeah.
you.
All right. Well, have a great time. And thanks again.
Thanks again.
Bye-bye.
Bye.